Hello everybody, Dr. Moser here at Structure Chiropractic. I wanted to take a minute to shoot this quick video and first off start by saying today is my wife's birthday. So I'm shooting this video and I'm excited to get back home to be able to spend time with her as well as spend time with our son Hoyt. But I wanted to make sure I address this topic because I've had a couple people reach out on this particular topic talking about colon cancer. So when we're talking about colon cancer, we're talking about any cancer at all, it's really important to make sure that we know the facts and know that whenever we have these diagnoses, that it's not necessarily that our body is ill, for lack of better words, it's in a state of dis-ease, which means it's not functioning at 100%, and there has to be some sort of stimulus that's forcing the body to go into this diseased state. So just like anything else, when we have a condition in the body, we want to make sure we find that underlying cause. Otherwise, all we are doing is just trying to mask symptoms, just like anything else. When I talk about blood pressure, if you take a blood pressure medication, did you have high blood pressure because you lacked that medication? No, not at all. And it's kind of silly to even think that way. But again, when it comes to something so destructive to our world and our society, such as cancer, we tend to go into this fearful mindset. And that fearful mindset is not conducive for health at all. So I wanted to make sure I touch base. I'm just going to try to make this video very short and sweet and to the point. But know that if you have been diagnosed with this, I'm not licensed to be able to say that we take care of cancer or we treat cancer, because we don't. I want to make sure we put that disclaimer out there. But what we do a phenomenal job with is eliminating triggers in the body that would express itself as cancer. So as a side effect of our treatment, sometimes cancers can go into that state of remission, which again is a term I don't really like all that much. You're either going towards health or disease. So once you get that cancer-free diagnosis, you have to make sure you keep living that lifestyle. Otherwise, you're just going to slip back into that same disease state. And it's only a matter of time until we get diagnosed with cancer somewhere else. So let's talk about this. So what is colon cancer? So colon cancer is something that can happen to a lot of people. Usually it's over the age of 50 years old or so we develop colon cancer. Now cancer as a whole can take anywhere from about 7 to 15 years, research is all up in the air for that, for a tumor to actually be detected in the body. So it's important to make sure we're running preliminary tests to make sure we're going towards health and well-being instead of sickness and disease. So it's ultimately up to you what you want to do. So now I'm going to share my screen. I made a PowerPoint for this this particular event here. So colon cancer, what you need to know. If you still need to see my pretty face, it's up in the corner right here, okay? So colon cancer, what you need to know. So going into what it is. So what is a disease? So we talked about this previously. So disease is a lack of ease in the body. It's stress due to some sort of trigger, whether that is an external trigger or whether that's an internal trigger. So what happens, say your hand hurts, okay? And just like the example I have written here, if we have our hand on a burner and we burn our hand on the burner, if we just pretend that, okay, let's throw something on here real quick and pretend that the burning went away, that wasn't the underlying cause. If we pull our hand off and we bandage it up real quick, put some aloe on it, whatever we need to reduce the burn, and we put our hand right back on that same burner, what's going to happen? What's going to happen is we're going to keep triggering the same disease effect or that same state of dis-ease because we have the same trigger. So whenever it comes to your hand, the example is the burner is a stimulus that's causing heat. Heat goes into the hand, causes a burn, causes pain, and we patch this up. And if we put our hand right back down what was causing that pain and that heat and that sensation, that burning to begin with, it's just going to be this perpetuating cycle. So when you go into your doctor's office, whether it's a chiropractic office or functional medicine office or a medical doctor's office, we can't go in saying, you know what, I've got a headache, only treat up here, when it could be something else in our body that's causing us to exhibit that particular symptom. So that's where medicine kind of gets hung up, is if you have a disease, you have a medication for that disease. There's their cause and their effect, more or less, but they're trying to cover it up. But you don't have that condition because you lack that medication. Okay? That's the bottom line. So you have to make sure you get to the bottom of it. So, so don't say that you just have a problem or a symptom or a disease. You have to figure it out and dig and dig and dig until you find out that underlying cause. Okay? Now, once you remove, say you remove your hand from that burner, and all of a sudden you start healing that up, guess what? If you keep your body in that healthy environment, not in that toxic burning environment, your hand will heal. It's what our bodies are designed to do. Our bodies are always healing, and the coolest part is without our knowledge, because it's a subconscious process. It's not something that we have to physically say, oh shoot, I burned my hand, I need you to make new skin cells and throw this and that and shut off these pain sensors. Your body does all of these things naturally. It's really, really, really neat how this works. And a side tangent on that, our son just split his lip open last Thursday, and he had stitches in his lip. Stitches ended up busting anyways, but you can see there's a scab that has grown over where he slit his lip open. And what did that? Hoyt is smart. Like, don't get me wrong, that kid's brilliant, but he doesn't have to consciously think about platelets being put and cauterizing agents being put here to heal it. So his body is doing it for him. And there's nothing different between us being a child and us being an adult, except a lot of us are overeducated with this stuff, and we're told for many, many, many years that our bodies are unable to heal itself, especially whenever it comes to cancer. So stop treating the body like a car and make sure you run the proper diagnostic tests on what's causing your overall disease state. Now, I pulled some statistics here. So disease of the Western nations is what they're calling colon cancer. And I pulled this out of a book that's over here. It's called Vital Strategies to Cancer by Dr. Roche. That guy is a brilliant man, and if you are even curious about cancer at all, you should definitely get that book because there's a lot of really great information in there. But there's a 10-fold higher increased rate of colon cancer in America because of our diet, because of our lifestyle. We eat very poorly here. So what type of dietary modification should we make? Now, what they say in the book is that we need to make sure we're eating more fish, more healthy seafood, okay, a more vegetarian-based diet, and it actually reduces the risk of developing easy for me to say. It reduces the risk of colon cancer by almost half. So if you're worried about getting colon cancer, you have a 50% chance of reducing your risk just by changing what you're putting in your mouth. That's pretty cool. Again, all I do is try to empower my patients, my clients, to make sure they're the ones taking responsibility for their health again. And if you feed your body what it needs, your body will ultimately be able to express itself at a fuller form. Minimize your red meat, optimize fiber, and eat only organic and pasture-raised. This is huge. A lot of people will ask me this question: is it important to make sure I'm eating organic? And the question is yes. There are some fruits and vegetables that have a harder skin or harder rind around them, and you don't have to eat those, like avocados as an example. You don't have to eat those organic. However, especially your berries and things like that, they're saturated with pesticides, and you have to make sure you're getting yourself some nice organic berries. And then for your meats, make sure you're getting organic pasture-raised meats, so that way you're not getting hit with antibiotics that they feed their cattle. Now, the other thing that was cool is reducing your risk by 25% by drinking green tea. So a lot of us drink coffee on a daily basis, and a lot of coffee is very acidic. That's why I'm very, 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 very specific with what I put into my body. And the only coffee that I'll drink is bulletproof coffee. The reason that is because it's guaranteed for a clean, I think it's a clean guarantee, which means there's no pesticides and there's no mold or mycotoxins that are found in that particular coffee. So you have to make sure you know what you're putting in your body. And if you are eating something or drinking a coffee that does have pesticide in it, usually a side effect of that is you're going to be going to the bathroom almost instantly. So you shouldn't have to use coffee in the morning to initiate your bowel habits. If that's happening, it could be because you're drinking pesticide full coffee, or coffee that's full of pesticide, and it's not going to be healthy for you or your digestive tract. Okay, so that's just another really important thing to make sure you know of. And then the other thing here is alcohol and diabetes, or drinking alcohol and having diabetes, increase your risk almost by double. So just like we said, if you change your diet up, it's going to reduce your risk by 50%. If you don't change your diet to reflect that type of lifestyle with a fish, kind of a pescatarian, vegetarian mixed with fish, not only are you going to put yourself at a higher risk for colon cancer, but you can, if you're eating your starchy your grains, it can increase your risk of developing type 2 diabetes, which would then increase your risk of having colon cancer. So there's a lot of things kind of going back and forth on this, where really it comes down to what we're putting in our body makes a massively profound impact, and we have to make sure we're going the right way. So the other question that I always ask people is, how is your poop? Okay, it's a topic I touch on nearly every day. Now, when I made this PowerPoint, I didn't realize I said I touch on poop every day. I don't, but it's one of the most common tests that we're running in our office because it gives us so many vital markers. Do we have an infection? How are our probiotics doing down there? Do we have any parasites? What kind of yeast load do we have? Bacterial load? What do our inflammatory markers look like down in our gut? So the one test that I love to run is a doctor's data comprehensive stool analysis with parasitology. The reason I like the comprehensive analysis is because what it does is it actually gives you a lot of those inflammatory bowel syndrome and inflammatory bowel disease markers. So if we're developing things like ulcerative colitis or Crohn's disease, we can see those markers show up on some of these tests. And what that would allow is that even if we are going to get colon cancer, if we have an infection that's in our gut, we have a higher risk of developing infection and colon cancer anyways, mainly because we're going to be more inflamed. So make sure we understand the difference between those there. Now, going down some more toxins in your gut, the more risk it is for developing colon cancer. I just said that. So make sure you're going number 2 daily. And so remember, number 2, you want to be going to the bathroom at least 2 to 4 times a day to make sure you're keeping those toxins moving through, because the more time that those toxins have to sit in your digestive tract, the more of a risk it is to cause more damage to that actual intestinal lining. Kathy, thank you for jumping on here. I appreciate you. Okay. So the other thing too that's going to be massively important is trying to reduce your stress. So chronic stress deteriorates your stomach acid. So what does that mean? So stomach acid is one of our main lines of defense from having disease states in our gut and also in our entire bodies. Now, the stomach does 2 very important functions. The first one is it breaks down our food. Okay, so it breaks down the proteins and allows it to digest and absorb. The other thing it does is it sterilizes the food. So we already talked about infections. If we have low stomach acid concentration, not low pH stomach acid, but low concentration of stomach acid, that means we're allowing for more infections to go through and pass into our intestinal lining. We don't want that because then we'll have a bad microbiome. The other thing it does is it causes our bodies to not have the ability to break down proteins. So we talk about food sensitivities, we talk about food allergies all the time. We have a higher risk of developing these sensitivities if we have a lower concentration of stomach acid. The reason being is because we can't break down the food the way it's supposed to be, and when those proteins aren't digested properly, it slips into the bloodstream and elicits an immune response. So that immune response would then be found on a test and say, oh my gosh, I'm allergic or I have sensitivities to X amount of foods. Here's what they are, here's what I have to avoid, and it's going to be a while so I can reintroduce them back into my diet. It's not a lifetime thing, but it takes a while to be able to reintroduce them back into your diet, as long as you're repairing and rebuilding your gut. Otherwise, the more you consume them, the more inflammation you're going to cause, the more you're going to be causing leaky gut, more infections can slide through, and it's just a messy, messy pattern for you, okay? All right, going through. What tests are necessary? So this is another common question. So what tests are necessary to try to help to eliminate those triggers in your body? So that we already kind of touched base on them. The stool test is going to be massively important, as well as the food sensitivity test or food allergy test. So here's the thing is I can run tumor marker panels on you day in and day out, but really tumor markers are just going to let us know how aggressive are the tumors, but it's just going to say, hey, you have some cancer here. It doesn't tell you the cause. It just says, we found it. You got some. So why do I want to test food sensitivities and a stool test first? Is because it will let me know what type of things are going on inside that we need to work on improving, so that way we're not causing inflammation in the body and we're not allowing these tumors to grow at a higher burden rate. Now, usually when patients come to me and they're working with cancer, they have tumor markers that have already been run before, but we do have panels that we have here as well. But I'm more concerned about treating the patient for the patient, not because of the disease. And that's why we get great results here, is because we don't treat symptoms. We just treat the patient, and a patient goes back to healthy healing, healthy function, and they start feeling amazing, and that's what it's all about. Okay? The other thing to do, other tests that are massively necessary too, is a set of x-rays or films. Why? So when we're talking about the overall health of the body, we cannot be healthy if we don't know what our spine and our nervous system looks like. That's the end, be all, end all. If we have any subluxations in our spine, which are when bones, sections, or curves of our spine shift away from normal, that means our bodies are not going to be able to function at 100%. It's like a kink in a garden hose or a tripped fuse. So if we need to restore function there, so we can be trying to treat these symptoms and repair the gut day in and day out. But if you have scoliosis or an abnormal curvature down in your back, the nerves going to your digestive tract are not going to be able to turn over those cells at a healthy rate. You're just going to be sending sicker and sicker and sicker signals to your intestinal lining, and so you're going to be replacing a sick cell with an even sicker cell. And so the time frame for recovery takes a lot longer. So I'd rather nip that in the bud, make sure you get a set of films done so you can see what your spine looks like, get it adjusted, and restore function to the body, because really health is 100% function. The other thing that I like to see on films is on the ADP lumbar film is I want to see your gastric air bubble. I want to see what your stomach acid looks like. Now, there is a simple way to test for stomach acid, and that's taking a betaine HCl supplement, which we have in the office. And when you take a high concentration of that, or you start to ramp up your concentration of that, it lets you know how low your stomach acid concentration actually is. So again, there's a lot of things that kind of come into play, and if you do have low stomach acid, one of the questions that I'll ask you is, what are your stress levels like? Do we need to maybe lower your stress levels or give you an herbal supplementation to lower your stress in order to allow your stomach acid to increase again? So there's a lot of things that come into play with this. I'm trying to throw as much out there as possible so that way you can use some things, but I want to make sure you understand that every person has to be treated as an individual, not as a disease. So what might work well for one person with colon cancer might be completely different than what works well for the next patient. So treat yourself properly. Make sure you're testing. Okay? All right. Let's keep going in the wrong direction here. So treatments. All right. So everyone wants to know what treatments would work. So I'm going to go through a giant list of treatments that could potentially work for these particular situations. So we don't treat anything to begin with. We work on eliminating triggers and healing the body. Eliminate stress, eliminate infections, food sensitivities, increase normal healthy stomach acid levels. It's huge. Dietary concerns. They say being obese, having weight gain, you have to make sure you nip that in the bud as well. Lose the weight properly, okay? Lose it properly and avoid anything inflammatory to our digestive tract. So whether that's eating non-organic or eating our food sensitivities, or we drink pop or eat candy or Tums or whatever it is, reduce those things and your body will start to heal. Now the other thing is, someone's like, I don't want to run a food sensitivity test. What can I do? I say eliminate corn, wheat, soy, and dairy. And they'll typically say, I'll run a food sensitivity test and see if I have to avoid them. Those by nature are inflammatory, and if you truly are trying to be healthy, you should cut those out of your diet so that way you can heal properly. The other thing we touched on is drink green tea. Avoid folic acid. So folic acid is one of those things where I don't know why a lot of OBGYNs or docs are telling people to eat folic acid. You need to make sure you're taking in folate or a methylfolate supplementation. So it's an actual broken down active form of folic acid, which can help our body rebuild and repair and detox properly. And with a lot of people having MTHFR gene, if we're throwing folic acid into somebody with MTHFR, we're not going to be able to break it down. It's going to cause more harm than more good. So make sure you're doing a methylfolate supplementation. Avoid high alcohol concentration. Don't be diabetic. Avoid smoking. Some things that you can do naturally as well as if you have essential oils. Frankincense is a great way to calm down inflammation, as well as boswellia. It's kind of the same thing. Boswellia serrata and frankincense go hand in hand. They're also more effective than aspirin. You don't want to take that baby aspirin a day because that can cause massive harm to your body. Limit your gluten-free grain intake to 1 to 2 servings a week. So we're going in a much lower carbohydrate intake while we're trying to increase our fiber intake. So that way we're keeping things moving, things out and through. Avoid antibiotics unless you're going through something that's absolutely life-threatening. Eat organic. Glyphosate will rip up the gut. P5P supplementation can reduce your risk by about 48%, whereas Resveratrol gives you about 50% protection. If you have low vitamin D, if you increase it back up to normal, it can reduce your risk by about 27%. Magnesium is kind of like a as-needed basis. Make sure you're using it to make sure things are moving through properly, but you shouldn't have to be stuck on that for the rest of your life, just like anything else. And lastly, make sure you get some exercise in, because exercise increases gut motility, which means you're going to be allowed to push things through properly, and it improves your colon cancer survival rate by about 53%. So I gave y'all a bunch of different ways to work on healing your body up, and this is just a quick summary. Test yourself properly. Avoid SAD. Avoid the standard American diet because it is sad. Eat organic. It truly does make a difference. Reduce stress in your body and allow your body to heal. Make sure you're getting adjusted. Make sure you're pooping. So that being said, if you know somebody going through this or you're just trying to share this with somebody, it's short enough. It's only about 20 minutes or so. share this with them, tag them in the post, like, comment, share, whatever you need to do to get this information out there. But the goal is to empower whoever it is that sees this information. So thank you all for tuning in. Thank you for everyone who's about to tune in on the replay, and I'll talk to you soon.